Hello, and thank you for becoming a patient at Whole Health Center Houston. We are so honored that you've trusted us with your care. The purpose of this video is to give you a quick overview of the very important parts in your patient portal that we need you to pay close attention to as you are going through your onboarding process. So let's just jump right into it. This is obviously our main website, and I just wanted to show you that from our website, wholehealthhouston.com, you can access the patient portal right here. Just click on that link and it takes you straight to the portal. The other way to get here is to type in the web address, portal.wholehealthhouston.com. That takes you to the same page. Also, when you became a patient, you likely received an email regarding activating your patient portal. That would also have the link to get you here. So there's many ways to get here. When you're here, you're going to type in that username that was set up for you when you became a patient and the password that you would have set up through that activation email you received. Now, hopefully you still have these. If you've forgotten them or simply just can't get on, please use the appropriate link here, the forgot password or forgot username link, to get in. If you're still having difficulties, do not hesitate to give us a call and we can help you out directly. Okay, so let's get into it. We're going to try to keep this video relatively short. So this is your patient portal with Whole Health. The text over here is just telling you what you can do in the portal, so you don't really have to pay a lot of attention to it. If there's an important announcement from our clinic, it'll be bolded and highlighted up here on top and you won't be able to miss it. What I want to call your attention to is everything over here on the right. So again, this video is principally for new patients, so we're not going to touch on everything over here. We're going to hit what you need to go through before you step into our office on that first day for your first visit. So go to the My Accounts Detail tab, and when you are here, we want you to verify that all of your basic contact information is correct, no typos. If anything needs to be updated, please change it and click on Save Account Details. Also, we do keep a photo of you. So if you don't have one yet uploaded, then when you walk into our office that first day, we're going to snap one of you, and it's probably not going to be your best shot. So most of our patients we find prefer to choose and upload their own photo here. We just ask that it be a photo that clearly shows your face. And then the last section here is the insurance information. Now, because we are an insurance-free practice, we really don't use this information for anything, but you are more than welcome to put it in here if you wish. Okay, the next thing that you will need to go and do is the questionnaires. So as a new patient, you're not going to have this many questionnaires. Yours will likely have anywhere from 2 to 4 questionnaires in it. These questionnaires are critical and important for you to get filled out prior to your first visit. In fact, well in advance of your first visit, so our doctors and providers have plenty of time to prepare for you. We really want to know as much as we can about your health history and what you're seeking before you come in so that we can help you the best and make the most efficient use of our time. Filling out the forms is very easy. You just click on the Start button, fill it out to the best of your ability. You'll see that a couple of the forms, really you'll probably only have one lengthy one. But if you get halfway through and something is calling you away from the computer and you just have to put it down for a while, we do have the feature to save the form and continue your work later. And when you do that, it'll put this next to it saying, so when you log in next time, you'll have the option to continue your previous form. So you just continue it and pick up where you left off. Very convenient. When you get to the end of the form, there's a Submit Form button. It comes in on our side and you're done with it. And it will tell you that you have submitted the form, such as this, last completed on. Okay, so these are the intake forms. I'm spending a little bit of time here because it's extremely critical that you get these in. In fact, if you do not have these forms completed by the time of your first visit, we will have to reschedule you. We absolutely need this information, so please come in here and do this. The next section is labs and documents. Now, as you continue in your care with us, we'll be sharing documents with you through this, but right now as a new patient, the most important thing is for you to share documents with us. So if you have any lab results or anything else that you need to share with us that's in a document form, please upload it through your portal here. Just click on this upload document, give it a title, choose the file off of your computer, put any notes about it, and click on Save Document, and that will get it directly to us, and we will add it to your chart, and we will put it to your provider's attention to review prior to your visit. So again, please take care of this before your first visit. And then the other tab that's important is your medications. Most of our new patients come to us on at least one medication, if not 10 or 12 medications. Regardless of the number, we need you to put them in here so our doctors know what you are already on before they go and try to prescribe anything else or get you weaned off of your current medications. Doing it is very simple. You just click on Add. You start typing in the name of the prescription drug here. You'll see that it pulls from our database all the different dosages. You would select the appropriate one, put any notes about it, such as I've been on this for a month, I take it twice a day, and on, and complete and add that medication. And when you do that, it'll show up here as a pending request to add that medication to your chart. We take care of those on our side, and once we do, it gets added to your medication list. So again, please do this for any medication that you are on. We have the exact same thing for supplements. So John Doe here has lots of supplements, but you would just add a supplement. And similar to medications, when you start typing in the supplement name, it'll pull from our database matching items. You would select it. Maybe you want to put the brand name of the collagen peptides you're taking, and you add that supplement to your chart. So new patients, please add all your medications and supplements to your chart prior to your first visit. And then lastly is going to be the pharmacies. Come in here and please add your preferred pharmacy. Though our doctors and providers generally prefer not to prescribe medications, they do prescribe medications when necessary, and we like to have your pharmacy on file so that we don't run into any hiccups. Doing it is straightforward. If you get it from a Sam's Club, for instance, you can just start typing Sam's, the address, any information you have. It'll pull it from our database of pharmacies, select it, check here to say that, yes, this is my primary pharmacy, and then you would click here to add that pharmacy. Okay, it's very straightforward. Some people have 2 or 3 pharmacies that they like to add. If they have a primary and they have a couple of backups, that's okay. And some people use compounding pharmacy. If you're on hormones that are compounded, add that here also. That's perfectly fine. Okay, so that is the brief overview of what you need to go through as a new patient onboarding with us at Whole Health Center Houston. I hope you have found this helpful. Please just pay close attention to everything we've requested of you to fill out, and your first visit will go much more smoothly and you will benefit much more for it. Okay, thank you for taking the time to watch.